Welcome back and thank you for staying with us on Punchline. As Kenya stays on the alert, the World Health Organization is warning African countries to prepare for the worst. Several countries have appeared to record a similar upward trajectory in infections as each week passes, with case counts moving from single to double digits in a matter of days. So what chances does Africa stand against this deadly virus, and what lessons can we learn from our recent history with other medical emergencies on the continent? Joining us now from the WHO Regional Office for Africa in Brazzaville, Congo, is Technical Officer Dr. Mary Stephen. Dr. Thank you very much for speaking to us today. What do you think?
Thank you for having me.
Thank you, thank you. As of this morning, according to the WHO tracker, the total confirmed coronavirus cases across the continent numbered less than 1,937 to be specific, in 38 countries. That is less than 0.5% of the global cases, and the continent has only recorded 24 deaths, again this being a fraction of the over 10,000 deaths recorded worldwide. Why do you think then that Africa has so far not been as heavily impacted by COVID-19 as the rest of the world?
Okay, COVID-19, as you are aware, is a new disease that was first reported in China in December 2019. And of course, given that it's a new disease, the implication is that the spread or importation to other countries is going to be as a result of travel. So now, when China alone was infected, maybe because of the level of travel between Africa and China and some other measures that the country put in place, we didn't see a lot of importation to Africa. But when we started having many more countries getting infected, like the Europe, the US now, and Iran, for instance, we started having a lot of importation of cases in the region. And of course, we are part of the part of the continent that has gotten the last form of importation. So probably because of the level of travels and of course the increase in terms of how people commute between this region and the rest of the world.
It's interesting that you point that out, because WHO itself had given advice for international traffic in relation to coronavirus. On the 27th of January, it says measures to limit the risk of exportation or importation of the disease should be implemented without unnecessary restrictions to international traffic. But countries have largely ignored that advice from the WHO. Are you therefore admitting that the correct thing for countries to do is to limit travel and to shut down the risk of importation of the virus?
Okay, so WHO continues to advise against implementation of measures that significantly interfere with international traffic. But what we are suggesting that countries should do, if in their own sovereignty they decide to implement some of these measures, to make sure that the measure they are implementing is based on risk assessment, and the measure should be commensurate with the public health risks. So it shouldn't be like, closing your eyes and banning travel. It may not be the solution to, containing the outbreak perfectly, because you have to look at the implication also, I mean the negative consequence of putting these stringent measures that interferes with international traffic. So the government has to weigh the risks against the disadvantages, and of course every measure they are putting in place should be based on the public health risks.
I think the advantages would be obvious to the public. What would you say the disadvantages would be in terms of total ban on international traffic?
Okay, so we are seeing countries completely closing borders, and of course this in a way can hamper the response efforts, because we need supplies going to the countries, we need experts going to the countries. We are in Africa, and of course a lot of countries in Africa need additional support, and when we close the borders, we are preventing this support from happening. So we have to really weigh the advantages and the disadvantages before we start imposing these stringent measures.
Right. To what extent is the WHO advice that has been given on dealing with COVID-19 adapted to the circumstances of poor countries in the continent whose citizens may not be prepared to take on the quarantine measures that are happening for rich countries? For instance, many Africans cannot afford to spend a day out of work. They're living on less than $1 a day. In other cases, many Africans are living in heavily populated areas, either in villages or in slums or even in urban centers, and they cannot afford to self-quarantine. Are you adapting your messages to them?
Okay, so now this outbreak response is supposed to be a whole society and whole government approach to this outbreak. And of course, there is a global solidarity around this outbreak. So now, in terms of measures, right from the beginning, countries in Africa, given the fact that we were kind of the last region that started having importation of these cases, we had a window of opportunity to enhance our readiness capacity, of course, to build capacity, to detect early and respond. So for containment of the outbreak, if the countries can focus on it to detect early, respond to this outbreak so that we prevent the spread. And also, in addition, the issue of not staying a day out of work. We are seeing innovative ways. Countries are getting innovative ways of working, options of teleworking, for instance, working from home. And countries should look at all these innovative ways of working. In terms of the population also,
Doctor, because, things like the internet, really, that is a luxury that many would say would be for the rich on the continent or those who are upwardly mobile in one way or another. Let's be very specific. What would you tell an African living perhaps in a slum in Nairobi or in a settlement in Kampala to do in terms of quarantining and limiting their interaction with others?
Okay, so in terms of self-quarantine, for instance, if an individual happened to be a contact that is asked to, or you have had contact with somebody that is high risk, and you are asked to self-quarantine at home, and of course, we know the society in Africa is a bit different from what we have in Europe, but we expect that if an individual is not able to observe these measures at home, we can also alert the government and see where the government can come in to help out in terms of making sure that they do the quarantine properly, because it's going to pay off at the end of the day.
Very briefly then, what would you say are the lessons that WHO has learned from other health emergencies on the continent? For instance, Ebola, the Ebola epidemic in West Africa in 2014, that can be adopted to dealing with COVID-19?
Okay, so one of the things that we learned is that outbreak, once an outbreak is reported, we need to start the response early. First of all, about the reporting, it has to be reported from the first case. Once the government identifies that there is a potential infectious disease happening, the early reporting is essential in terms of how you contain the spread of the outbreak. Also, in terms of our capacity, making sure that we are ready with basic capacity for detection, for response to certain outbreaks. So African countries should build, when they are responding to a particular outbreak, building on existing systems. So not creating something different, but at the end of the outbreak, you will have a better system than when you started the outbreak response. And this, you can use this system for response to subsequent outbreaks as well. All right. So early reporting and making sure that we prevent the spread of the outbreak should be our goal. But where we have a spread of outbreak, we should implement measures that can help us to quickly contain this outbreak.
Right. Finally, and very briefly, is it your expectation that African countries will need to take on a lockdown in the style that we have seen China or Italy undertake, or would it be better to look towards South Korea, which has tried to avoid a complete lockdown?
Okay, so now countries should take these measures on case-by-case basis. Of course, we have to look at our context as well. The African context, as you are aware, is different from the context you find in China, is different from the context you find in South Korea. But I know that South Korea also did a lot of testing as well of people that are high risk. So Africans need to look at these lessons they have learned from other countries that have responded to this outbreak before and implement those measures in context. Yeah? In context of what they have as a country, of course, assessing the risks and looking at the advantages and disadvantages of every measure they want to implement.
That's rather non-specific, and understandably, even within Africa, there are different scenarios. But having said that, like you have said of the South Korea example, is the fact that they were able to do even thousands of tests in a day, something which the continent is obviously struggling with. Kenya, for instance, is reported to have just a little over 10,000 kits for a population of 49 million people. Has WHO developed any kind of guidelines in terms of how exactly testing should be done commensurate to the population or any other factors?
Okay, so testing right now is encouraged that people, especially in the African context and given the limitation that we test people that have symptoms. So you test suspected cases because we don't want people going about testing even asymptomatic people, because at the end of the day, if we exhaust what we have and then we begin to have additional cases, that is going to pose a challenge for the region. So let's make sure that we are testing people that have symptoms already. So somebody that is suspected and has met the case definition, then we can do the test so we can maximize the capacities we have in the region.
Thank you very much for joining us all the way from Congo, Brazzaville. Dr. Mary Stephen is a technical officer with the WHO Regional Office. Thanks very much from Nairobi. And it's time for us to take a short break. We're going to return with more views and, of course, taking you around the world as we speak to Kenyans in different parts of the globe, how they're coping with the coronavirus as their countries are on shutdown. Stay with us.